This video, titled Non-invasive surgery for a sprained ankle, is an excerpt of a presentation which was done in 2006 in the Inter-Japan Congress of Judo Therapy. As obviously stated on the official webpage of the Ministry of Health, Labor and Welfare, health insurance covers only cases of fractures, dislocations, contusions, and pulled muscles in a judo therapist's practice. So, lower back pains are not included in the judo therapist's practice. However, many lower back pain patients have been visiting judo therapist's office. Needless to say, the fee for these patients is expensive, and the insurance doesn't cover them. Therefore, judo therapists must acquire a skill level that is deserving of an expensive fee if they treat not only lower back pain, but also other injuries the insurance doesn't cover. In this presentation, we'll compare the concepts and effects of conventional methods and the newest medical approach and reveal its results and importance. The word reduction, the judo therapist says, means repair injuries like fractures or dislocations into normal conditions. So, likewise, in this presentation, we will detail the treatments that restore fascia into their original anatomical shape through non-invasive surgery. And the methods to achieve this is called facial distortion model. In the presenter's clinic, before he was introduced to FDM treatment, he used to apply electric stimulation, heat or ice, applying compress and so on. But after he employed FDM treatment, his success rate for treating lower back pain had dramatically increased. Especially in the first session of serious cases of acute lower back pain, it was obvious. The only thing we could do before FDM was ice the lower back, recommend rest, immobilize, and just wait to heal. Before FDM, the doctor was afraid to treat lower back pain. But after starting FDM treatment, we were able to get much better results by treating patients more aggressively. This table compares an FDM practitioner's success rate for non-invasive surgery before they used FDM and after. As you can see in these figures, it is obvious that the results after the practitioner was introduced to FDM treatment had increased. So, the number of sessions also decreased. Furthermore, according to these figures, the success rate increased after the practitioners employed FDM. So thus, the number of sessions decreased. Now, we will show you how the FDM treatments are performed. X-rays or tests, such as those which evaluate a patient's range of motion, are used to make a diagnosis in conventional medicine. Whereas in FDM, we observe a patient's complaints about their symptoms and their body language. In this video, we can see that the patient is pushing the painful area with her finger, namely in her lower left back and hip. Furthermore, the patient is expressing a pulling pain with both hands. She is also pointing to painful spots around the SI joints with the tip of her finger. Although this body language is frequently observed in acute lower back pain patients, it is often ignored or overlooked by conventional medicine. However, to perform effective treatment, a therapist must observe all body language. These observations lead to a proper diagnosis and treatment. For this patient, the fascia of the lower lumbar area is being treated. This is treatment for injuries of lumbar soft tissue that cause pulling pains. Here is treatment for injuries of the pelvis area. In this clip, we see treatment for injuries of the hip muscle. this clip, we see treatment for pain around the SI joint. In this method, the purpose of treatment was not for SI joint subluxation. Instead, it is for restoring the fascia around the SI joint. So this method is completely different from chiropractic methods. Here we see treatment for fascia around the lumbar joints. Inevitably, it caused pain since the therapist directly treated injured areas with manual methods. However, as a result of applying FDM treatment, the patient became able to walk, bend her back, and on the next day, she could squat, stretch, and regain normal functions. This result proves that FDM treatment has immediate effects, and it is not a temporal stimulation that manipulates pain.
まあスポーツ選手じゃないけど、明日走るとかやらないけど、このぐらいにしとこうか。
そうですね。明日また2時間ぐらい座りっぱなしなんですね、仕事で。ずっと良くなったんで、今日このままこう良くなるベースに
ハマればね。
進んでいくんですね。ちゃんと声援をして。
いや、動きよった。
動きよったらいい。
じっと座っとったらもう絶対。
ダメですね。家にあれがあるんですけど、ラテラルサイトレーナーって言ったら、こうする。
Now, we will explain how to understand lower back pain in the FDM model. The cause of acute lower back pain, which is generally referred to as a strained back, is the result of the alterations of fascia that were damaged by excessively barred external forces. This alteration hinders the range of motion and causes pain. However, the injuries that were altered by external force can be restored back to their normal shapes by force directed in the proper direction. Once it has been done, it is not an injury. No restriction of motion and symptoms are apparent anymore, since the alteration has already regained its normal condition. Therefore, the alleviated symptoms and the restriction of body functions are obviously recognized. The manual form of treatment that produces obvious and immediate results is called facial distortion model. The result of this video we saw is not an incidental result. To demonstrate this, let's look at some case histories. This patient suffered a serious back pain 2 days earlier. It was so difficult for him to stand up or stand straight because of the pain. He complained especially about the pain in his left back. Even when the patients complained about chronic pain like this, we were able to produce excellent results by analyzing the information the patient gave us and applying FDM treatment. In this case, the alteration in the hip muscles, lumbar muscle, sacral area, lumbar face were treated by corresponding FDM techniques. And the result was obvious, as the patient was surprised.
なんだこれ、走れるわ。すごい。すごいすごい。コンプライアンスしておきますか。いや。うわー。昨日までの何やったんですか。
Furthermore, in this case, the patient couldn't stand straight. We were able to produce obvious results by analyzing the information the patient gave us and applying FDM treatment. From these case histories, we just looked at, we can come to the following conclusions. In most cases, lower back pain is caused by the alterations of soft tissues that were damaged by external force. These alterations can be recognized by analyzing the information the patient provides us. And also, they can be treated by using appropriate FDM techniques. In this presentation, I did not speak about sciatica, nor clinical cases where patients experienced tingling sensations around the lower extremity, or other such cases. However, as you can see from the videos I presented, it is possible to successfully apply FDM treatment to lower back pain, including chronic lower back pain and sciatica. On a daily basis, FDM practitioners treat patients with lower back pain, so it is essential for us to acquire excellent technique in order to achieve immediate results. It is not enough to let patients heal gradually with time, or to simply apply massage-like relaxation techniques.